Hello everyone, and welcome to Sleep. My name is Tommy Ligatese. Today I have the pleasure of hosting clinical psychologist, Dr. Sylvia Gindy. On this episode, we'll be discussing insomnia and sleep. Welcome to the show, Dr. Gindy.
Thanks for having me.
So insomnia seems to be such a prevalent thing in today's world. What are the different types of insomnia that you're seeing in your patients?
So there are a couple of different types of insomnia that we see. One type of insomnia is acute insomnia. This is when the insomnia lasts for less than 3 months. This can happen if we've experienced some sort of stressor in life, and then once we've adjusted to the stressor or have adapted our life in some way, the insomnia just resolves itself on its own. The other type of insomnia is the type of insomnia that I'm much more likely to see in my practice, which is chronic insomnia. Chronic insomnia is when someone has trouble falling or staying asleep for at least 3 days a week for longer than 3 months. And oftentimes, these are people who have been experiencing insomnia for months or even years, because before they step into my office, they've tried so many other things to improve their sleep. Now, in terms of how the insomnia itself can present, there's a few different types of insomnia that we might see. So for people who are struggling to fall asleep at the beginning of the night, this is sleep onset insomnia. Then we have others who are struggling to stay asleep during the night. So this is known as sleep maintenance insomnia. And then we have people who say, gee, I want to get up at 7 for work every day, but I find myself waking up at 4 a.m. and I just can't seem to get back to sleep. So this is early morning wakening insomnia. And really, in practice, individuals can present with any mix of the 3 types.
What are some of the causes of insomnia that you see in your patients?
So there are lots of different causes for insomnia, but oftentimes what activates the insomnia is some sort of life stressor. And this could be a wide range of things, from the loss of a loved one to stressful work conditions to family issues. Some sort of life change that has activated the insomnia to be present. There are also medical conditions that can exacerbate insomnia. So we might see this with pregnancy. In fact, women are more vulnerable to developing insomnia because of all of the hormonal changes that they'll experience through their life cycle. So this can happen at times during their menstrual cycle. This can happen when they are pregnant, postpartum, or when they're experiencing menopause. We might also see that untreated mental health conditions can contribute to insomnia. In fact, if we look at the criteria for anxiety and depression in the DSM, we're going to see that insomnia is actually a symptom of anxiety and depression. So it's important that any co-occurring medical or mental health conditions that the person is experiencing is diagnosed and being addressed in order to help them with their insomnia.
So why is insomnia such a big deal? How can it affect our physical health?
The fact of the matter is that our bodies need sleep. When we sleep each night, our body has the opportunity to restore itself and perform a lot of important functions that it needs to do in order to be healthy. When we're not getting adequate sleep, it leaves us vulnerable to a host of medical conditions, from increased risk of diabetes, high blood pressure, weakened immune system, weight concerns. And when this is left untreated, it can leave our bodies feeling run down. In terms of untreated sleep apnea, there's also a host of medical concerns that might be at play. So high blood pressure, high cholesterol, we may feel more fatigued, and there can also be a mental health component. We find that folks with untreated sleep apnea are more likely to experience depression. We may also see periods of memory loss or confusion, because sleep is an opportunity for our brain to consolidate our memories and experiences from our life. So getting adequate sleep is very, very important in terms of keeping us healthy from head to toe.
So as a mental health expert, what are some of those effects on the mental health that insomnia plays a factor in?
So insomnia plays a significant role in our mental health. If we are not treating the insomnia, we can have exacerbated symptoms of depression and anxiety. One thing that I've oftentimes heard is, I don't have the energy to get through the day. It's harder for me to be productive. It's harder for me to concentrate when I'm not sleeping. And I think for those of us even who don't struggle with insomnia, we can all think back to a time where we had a poor night's sleep, and the next day it just felt harder to even get enjoyment out of life, to get pleasure and to be present with our loved ones. So insomnia can have a significant impact in terms of our mental health and just how we're feeling through the day.
So for the patients that are suffering from both sleep apnea and insomnia, what treatments do you recommend to those patients?
So we're going to want to treat both conditions, both the insomnia and the sleep apnea, in order for the patient to get the best outcomes. In terms of treating the insomnia, we're going to want them to go through a round of CBTI where they can learn helpful behavioral strategies to manage their sleep better and to get better sleep throughout the night. We're also going to want to manage the sleep apnea with their healthcare professional. Apneas are disruptions in airflow that cause the patient to have frequent wakenings and to get sleep that is not as restorative and restful. Now, there are a couple of options they can explore with their doctor as to things they can do to treat the sleep apnea. One common method that we see is CPAP. This machine is continuous positive air pressure where the patient wears a mask and it stops those airflow disruptions from occurring. This works well for many people. However, for those that it doesn't work well with, either because it's uncomfortable or bulky to sleep with at night and makes it uncomfortable for them, then they also have the option of using oral appliance therapy. This can be a great solution because of comfort of wearing it, it's lightweight and easy to travel with, and it can be a solution that just feels easier for folks who are not able to tolerate the CPAP mask.
Great, well thank you for coming onto the show today.
Thank you for having me.
Well, that concludes this episode of And Sleep with Dr. Gindy. We encourage you to explore the rest of the episodes and visit wholeu.com to learn more about the latest in sleep breathing disorders. The sleep professionals in this video series teamed up with WholeU to spread healthy sleep education across America and were paid for their appearances.